Good day everyone, I'm Queen Enriquez, Section 12F, Group 22, and a student nurse from Davao Doctors College. And today I will be showing to you my return demonstration about urinary catheterization. So first, let us know what it is. So it is the introduction of a catheter through the urethral meatus into a patient's bladder. So first we will check the doctor's order for catheterization. So this is to ensure that you have the right patient and right procedure to be done. Okay, so today I will be assessing Miss Gonzalez, and today we will be doing catheterization. So next is we will add to the tray the solution for cleansing the perineum and bring all the equipment to the unit. So this is to save time and effort. And so the equipment needed are the tray of catheter like urine bag, the 10cc syringe, sterile water, lubricant, plaster, and sterile gloves, forceps, and also the antiseptic solution. So after that, we will wash our hands before preparing the set. So this reduces the microorganisms that cause diseases and contamination. Next is identify the patient and explain the procedure. So the rationale for this is to have the right patient, to establish rapport, trust, and cooperation from the patient. So I will just check your wristband, ma'am. Okay, Mrs. Gonzalez. So they will be doing catheterization. So I will touch some of your body parts, ma'am. So is it okay for you, ma'am? So this is an order of the physician, and this will help relieve your urinary retention. So is it okay for you, ma'am? Okay, thank you. So after that, provide privacy by screening or closing the room. So now I close the windows, ma'am, as you can see. So this is to ensure privacy. We will position the patient in a dorsal recumbent with the knees flexed for easy visualization of the meatus. So we will now position your mom in a dorsal recumbent. Okay? And then drape the patient, exposing only the area to be used. This is to avoid unnecessary exposure of body parts and maintain the privacy of the patient. So, embarrassment and chilliness will make the client tense that may interfere with the introduction of the catheter. So, now let's go drape the patient. And I will be exposing some of your body parts, ma'am. So, is it okay for you, ma'am? Okay, thank you. So we must ensure that this area is covered. So next is apply direct light for visualization of the genital area. So provide good visualization of the meatus, which is essential to introduce the catheter. So as you can see now, we have lights. So now we will get the tray, open the tray, and arrange equipment for convenience and accordingly to avoid contamination of sterile items. So placing the equipment in order will increase speed of performance and avoid contamination of sterile items. Using the sterile forceps, cleanse the area using cotton ball with betadine, which is an antiseptic. So note for particular areas of inflammation, swelling, excessive discharge, or secretions from the orifice and presence of odor. So after getting the tray, we will now put the sterile gloves. This is to avoid contamination and to maintain the sterility of the set. So we will get the gloves. Get the other one. So next is we'll put the eye sheet. So after that, we will lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. So lubrication reduces friction and prevents urethral trauma, thus reducing pain upon insertion. So this is the catheter. I'll open it. So so this is an improvised lubricant. So we'll put some lubricant. So next is pick up the catheter at least 2 to 3 inches from the tip of the thumb. Place the thumb and one finger of the left or right hand between the labia minora. Separate and pull up gently. So this is to provide good visualization of the urinary meatus, like that. And then insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. So encourage patient to relax with slow, deep breath and insert as the client exhales, using upward and downward stroke for 2 to 3 inches or until urine flows. So relaxation of the external sphincter aids in easy insertion of the catheter. So slow, deep breath. Okay. In female urethra is approximately 1.5 or 2 inches. So if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. So allow 20 to 30 cc of urine to flow into the specimen bottle by not touching the catheter to bottle. So urine will flow off the catheter if lumen is not included, thus the purpose will be defeated and maintain sterility. So we will get the specimen holder. This is an improvised specimen holder, and we'll get okay, and we will put it here. So next is rest the hand in the pubis area while holding the catheter in place. So this is to prevent pulling and pushing of the catheter. So withdrawing the catheter and pushing it back to the urethra increases the possibility of contamination to the urethra. So after that, we will connect the catheter to the urine bag and be sure the bag is closed and kept the connection sterile, so that the urine will not leak from the bag and maintaining its sterility. So we'll get the bag. So this is an improvised catheter bag because we don't have any here. So this is an improvised urine bag. Then we will, and after that we will inflate the balloon 20 to 15 cc of sterile water using a 15 to 20 cc syringe. So making sure that there will be no leakage of water from the balloon, thus it serves the purpose of anchoring into the bladder. So we'll get in the sterile water here. So next is secure the indwelling catheter by tapping it to the patient's thigh. Allow some slacking of the tubing. So this is to secure the catheter properly. Slack prevents tension on the catheter. So this is just my improvised tester, and I will tape it um, to the thigh of the patient. And for that, put the bag in um, below the patient's waist in an unmovable position. So after that, place the patient comfortably. This fosters relaxation and comfort. So are you comfortable, ma'am? Okay. We'll just get. So after that, do aftercare of the unit and equipment used. So the rationale for this is cleaning the environment promotes comfort to the client. So next is we will remove our gloves and discard this one. And after that, we will do hand washing. So this prevents the spread of microorganisms. So after that, record the time of procedure done, observe character, amount, and color of initial urine output in the drainage system. So this is to determine if urine is flowing. So we will just record everything. Okay, mom. So thank you for your cooperation, mom. Thank you for being with me during the whole assessment. And you can now have rest, mom, and you can now relax. Thank you, mom.